Everyone. Well, happy National Public Health Week. I don't know if it's happy, but it's National Public Health Week. So, I know there's a lot going on, and I'm sure some of you have some burning questions. So this time is really for you. I feel like now office hours is really being used for like a touchstone, like a place just to like check in with everyone in general. And so if you're here just to kind of hear from each other, that's great. You're also welcome to network in the chat. So I leave the chat open during office hours. Again, this is your time. This hour is for you every Tuesday morning, 9 a.m. Pacific, 12 p.m. Eastern. And if you want to share your LinkedIn profile, go ahead. If you want to introduce where you're located, what school you're going to, just so that people know where you are. I have been hearing people connecting over time in person. I am in Los Angeles and I can't be everywhere, but just to know that you guys are connecting in different cities makes me so happy. It warms my heart to know that the network can extend to that degree. So please connect. Okay, but we are here to job search. I've been promoting this week's job alerts. I'm sorry, this week's office hours. I did job alerts yesterday. I released job alerts yesterday, thanks to Angie helping me pump those out on time. But I wanted to actually really focus on the matter at hand. The matter at hand is that people have been laid off, right? The Trump administration has laid us off um, or halted our funding or really has threatened the infrastructure of public health, so to speak. And as you can imagine, between last office hours, so April 1st was last Tuesday, and we were here sitting together last Tuesday as the news was rolling out that the layoffs were happening, the RIF was happening. And when office hours ended, my day just sort of blew up, and the rest of the days have just been the same as far as people just telling me, informing me that they've been laid off, even colleagues that previously had been hired through our community at the CDC and FEMA have officially been laid off. So it's been just horrible, to say the least, to hear from all of you literally getting laid off as we speak. And some of you are being told that you may or may not have a job. They're not even sure. And mind you, this is all trickling down. So some of you got hit really hard on April 1st. My heart goes out to you, obviously. And, we're here when you're ready to pick up the pieces of wherever you've left off. But I really feel like this this is something we're going to have to grapple with, right? This is something that's not going to change overnight. It could get worse. I don't know. But what I want to do for our community and what I know if is to help you in this crisis as much as I can to show you where the other options lie, right? So a lot of you probably assume that government was your best option, your only option where permanent jobs lie, right? And so the reason I wanted to really focus on today's job search to be about remote options, for-profit options, right? Corporate social responsibility, things that really, organizations that really need our skill set, but aren't your traditional public health space or government space, or even that traditional nonprofit space, right? Because a lot of you are getting hit because your organization is massively funded, receiving a lot of grant money, and a lot of you are also, walking on thin ice. So I don't want to keep steering you all in that direction if it's just going to keep hitting you guys and beating you guys up. And so in the spirit of everything going on and, given just how crazy it is and how much we, really beefed up our workforce in the last 4 years, given the pandemic, and now we're just being cut off by our heads, so to speak. I want to really be here for all of you. And if I were you, right, if I was still in the workforce, if public health hire didn't exist, If I was still, working, first of all, if I was still at Kaiser, I would just stay there. In fact, I had someone call me from Kaiser, a coworker say, "Hey girl, I'm not going anywhere. I'm staying here because things are tough out there." And I get it. If you can hang tight to your job, hang tight to your job. If you thought you were going to quit and you're like, "You know what? I need to take a little more calculated risk," take that time. The economy isn't looking good either, right? All the talks about tariffs and inflation and just cost of things. You guys have to really watch your finances, right? That's still up to you. But if I were you, and if I was unemployed, and if I was laid off, and if I had been job searching for months and nothing was still coming through, this is in the next hour, this is how I would be job searching. Okay, so if I were you, this is how I would be spending my time. So I wanted to at least, model that for all of you, given that you've really been seeking me out for guidance and support and just pointing you guys in the right direction. This is as best as I got. Like, come on, guys, keep searching. The jobs are out there, right? But you have to be mindful of the funding stream, where the money is. Okay, so before we get started, I wanted to just open up if there's any general questions. Maybe anyone want to share if, you were laid off, but I wanted just to kind of set the tone for the next hour, given it's National Public Health Week and given the crisis at hand. I'm checking the chat real quick. Okay, multitasking. Alexandra Paulson, I did have an interview and I asked where they're funded. It's an important question. Yes. So if you are, great, Alex, if you are getting interviews, wonderful. Folks are getting interviews, guys, by the way. My mentees are getting pulled in. So there's still a lot of work out there, right? Whether it's hospitals, healthcare, private organizations, associations, coalitions, foundations, philanthropy, they're still hiring. So that's great. And one way to ask about their funding stream, if you really want to just double check, triple check, how this role is funded, that's totally fine. I think you can do it in just in a way that's more about, can you tell me more of, the partnerships and the funding streams that support this work, right? So it could just be a very open-ended question. Or the organization. You can ask about, can you give me a sense of the funds that support the organization, whether it's private dollars or public dollars. You can even ask if they can give you a sense of, how much is public funding versus private dollars. That might be enough too. So yeah, there's a couple ways to go about it. I think it more is about what's already disclosed on the job. Sometimes the job will say, right, that certain things are funded a certain way. But when it's a large organization or a large foundation, usually that's just from the private dollars that's recycled back from the for-profit arm. So yeah, I think that's great. You need to ask. Nowadays, there's no harm in asking. I've been laid off too and here to connect with fellow public health workers. Yes, welcome, Yuko. I got your email, by the way. I'm so glad you took some time. I wanted to just to call out for those of you who feel like you don't even know what to do with yourself. That's totally okay. I have been getting messages from folks who really just are reconsidering public health altogether, right? I have gotten messages from folks who are like, I re-upped my license for LVN, or I think I might be going back to nursing after all, right? Like there's people who've been on the fence already or have already been trying and it's just not happening. And with all the news, they've just informed me that they'll keep following, they'll keep supporting, but they're feeling it. They're just like, I can't do this anymore. So I'm sorry to lose you if that's your choice. I get it. You have to do what's best for your family, what's best for you. But I will always be a reminder and a light for you when you're ready to come back, when you're ready to get to the workforce for prevention and public health. I try to remind you guys that this job search and employment process is not for the faint of heart. And I feel like it's the most backwards feeling because we, as public health professionals, we are genuinely such good-hearted people with good meaning and good intentions that it is such a mindfuck to experience this level of just rejection, declines, just doors being shut on your face, patience that is grueling, like unlike anything else. I sometimes feel like this employment process can be worse than dating for some, like it is horrible. So during this time of, being in this administration and in this last week, literally, if some of you are like, oh, that's it, I'm done. I can't do this. I can't do this. DEI has been slighted. Public health is just a wash. If that's how you feel, that's how you feel. I get it. And it all depends on where you sit too, right? I get it. Some of you are really hearing it, feeling it from wherever you're sitting in your community, but public health is here to stay, guys. It's not going anywhere, right? There are so many other companies that are looking for our talent. And there will be companies that step in where the government decides to step out, right? I mean, really great example, immunizations and children's health. Hello? Hello? We just had the second death of a child in the United States from measles. What? So as much as you all are, weary of, there's no more jobs. Oh, there will be jobs. It's just going to switch and pivot and we got to fill the holes, fill the gaps, right? And that's where you have to be resourceful, nimble. You have to be nimble in the next 4 years. You have to let go of being so rigid of what you thought it was going to look like, right? So, the work in children's health, immunization, vaccinations is on the rise. And I've been seeing a lot of healthcare companies step in for that matter. And it wouldn't shock me if you start to see philanthropy also step in because they're seeing it and they're hearing it from their constituents being the community organizations that they fund. So I'm just letting you all know that I notice these pivots in the job market because of what I'm reading, but also what I'm seeing, right? I'm hearing it in the news that there's this crisis happening. And then I'm also slowly seeing an uprise and uptick of titles like immunization coordinator, vaccine accountability, educator. Like that's happening, guys. Right? So just that is an example of how to pivot. Okay. Questions in the chat. Alex, I feel very nervous about my resume not beating the AI. Oh, the AI. The AI. Right. And then you got AI who's really messing with our heads and getting us scared to even apply. I would say keep in mind that the hired masterclass and the hired methods really walks you through how to tailor accordingly. And so I wouldn't worry too much about the ATS systems and the AI systems that they start to use on our resumes. I think it still comes down to you really mapping it accordingly and mapping your experience accordingly. So I honestly, I'm not worried. That's the least of my worries. So Alex, you'll be okay. As long as you follow the methods, like it'll be okay. And keep in mind, you really don't know what people are already using. Like, who's to say you haven't already been screened and passed through an ATS system? It's not like when you guys get called in, they tell you, hey, we used an AI system and you got screened successfully. No, you practically will never know. Okay, Janet, I wonder if you might see a rise and create a wing for helping people pivot out of public health specifically, maybe just in the short term. No, girl, I'm here to keep you all in here. I will help you stay in. I will help you stay in. My heart is in public health. I didn't quit my Kaiser job, to then quit on you guys. Come on. Like I've been in this field long. No, I have not been through this exact crisis at hand, but I know that you guys will get through it. And I know that I have the tools to kind of figure out and navigate and pivot and find. I mean, mind you, I'm still working with mentees right now, and we're finding some really great options. Like they're applying. I did 4 resumes this weekend. They're applying. So it's more of digging, getting resourceful. Like I said earlier, you have to be nimble. Okay, there's a skill in translating our experience to other sectors. There always is, yes. You know, and do what you got to do. I did release on Instagram, and I think I need to do a blog about this, is how to survive the layoff, you know, like getting a part-time job, looking for temp agencies, checking in with your alumni association, right? So if some of you haven't even tapped into, like, I don't want to say survival mode, but some of you might have to just figure out something part-time just to pay the bills so that you can focus on a full-time job search. That might be your best option. Because I know if I was in this situation of getting laid off, I would immediately look for a part-time job. Thankfully, I speak Spanish, hablo español. So here in LA, there's lots of work for bilingual speakers. So I'm very blessed in that regard. I recognize I have that talent. So if some of you are sitting on a skill that you just aren't using to get part-time work, right? You can do it. You can do it, right? There's tutoring work. There's be a substitute teacher for a minute, right? Going back to earlier comment, how do you pivot to other industries? I'm like, well, if you want to do something part-time, I'm all about it. Especially given that the part-time work would float you, right? Would float you through and actually let you focus on a full-time job search. Because keep in mind, this job search is a full-time job. Looking for a job in public health is a full-time job. And so if you jump into another full-time job that's not public health related, it's going to quickly pull you away. Right. So like I know someone who, for example, who just went into bank telling. She's like, I found a job with Bank of America. I can't do this anymore. I'm like, okay, well, I'm here if you want to, you know, get back into public health. Like I can't force you guys. I'm not here to force you into a career you don't want, not that you don't want to be in it, but like there's only so much that you can take, and I understand that, and I have to respect that. But I will always be here to give you the tools, you know, find some bright spots, show you the latest jobs. Every day there's jobs being pumped out. Okay, well then let's sift through the best ones, what's out there, just so that I'm really positive that I want to walk away or not, right? So yeah, there's things that you can do to stay afloat. So it's not all lost, but if some of you need to take some space and rethink your strategy, take some time. Take some time. I mean, I know it's not easy to say that when you can't afford it, but like there's no rush to immediately get back into the workforce if, you know, this is something that you need to just make amends with, make some peace with. I know if I was laid off, I would be like spiritually, mentally, and emotionally shocked. I would be like, what? Guys, I've never been fired or laid off. And so if that happened to me, I'd be like, what? Right? I guess I could say I'm blessed to have never experienced that. I've quit 3 jobs, 3 high-paying jobs. I've walked away from good jobs. But to be laid off and fired, I would be shocked in my core. So please, guys, like I'm serious. I know I'm all about getting the job and doing the work and blah, 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 but like take the space you need. Take the space you need, honestly. Honestly. Unplug from social media. Stop watching the news. Like when you turn it back on, it's just going to be the same thing. So protect your mental health. I know I had to unplug during spring break. My spring break came and went, but I'm just giving you guys permission to breathe. Please breathe. Okay. All right. So I know that I'm talking too much and not searching enough. Do you have any advice on how to stay grounded while doing a part-time job or taking a temp? Yeah, I mean, I think the part-time work really helps you at least feel like you can focus on the matters at hand and not feel like your time is being just like absorbed by, assignments and coworkers and, working weekends and stuff like that. So if you can find a part-time job that really works with your schedule, then I think it just helps you stay grounded naturally, right? Then you have access to, maybe you can go to the gym with a little bit of money, right? Maybe you could take a yoga class with a little bit of money. And so just having money a little bit allows you to just regulate your nervous system and focus on what is important. So to me, having the part-time job is just to help you with that financial, just we all need to pay our bills and we need to eat. So that's to me how it helps me stay grounded, at least.